Good morning. Welcome back to Daybreak on this 29th day of March 2021. Of course, we're nearing the end of the month, a month that has been very defining again in as far as the COVID-19 numbers. And we'll be looking at the impact of that, including how the infection rate has been as we do that. But as we start the conversation this morning, I want to introduce the panelists who's in studio so far. I don't know that the others are facing challenges of lockdown. Tony Watima, independent economist. Good morning and Happy New Year.
Good. Okay, good morning. I don't think we're in Happy New Year already.
Well, we're still there because I haven't seen you the whole of this year. The first quarter
Happy
is
New
coming
Year
to
too.
an end.
Happy New Year too.
All right, and we want to dive into the conversation around what you will see, the impact of the lockdown, the partial lockdown that was announced by President Uhuru Kenyatta on Friday. Let's begin by looking or listening to what he said in as far as the disease-infected zone that the 5 counties of Nairobi, Kiambu, Machakos, Kajiado, which other one am I missing? And Nakuru have become. Listen.
These counties are individually and collectively declared a disease-infected area. That there shall be a cessation of all movement by road, rail, or air into and out of the disease-infected area as one zoned area comprising of the counties of Nairobi, Kajiado, Machakos, Kiambu, and Nakuru.
All right, and that's President Kenyatta announcing that lockdown. It has really caused jitters across different sectors of the economy, including on the front page of the Daily Nation. You'll see that Uhuru under pressure to ease pain, and they are saying you're on your own because the president did not offer tax relief or social safety net program. And intense lobbying for the head of state to ease some of the COVID-19 lockdown measures announced on Friday, as tourism sector players say containment has put 1.3 million jobs at risk and suggest a less punitive safety plan. We'll be looking at that later on. But first, Tony, you look at this action by the president. Of course, the numbers, as we'll be looking at them later on, are worrying, and look at the burden that it's causing to the health sector. But when you hear of this cessation of movement within the 5 counties, quite a bit of limitation, and of course, these key counties, they're also driving force to the rest of the country. What comes to mind in as far as the prudence of decisions and the interest of an economy?
Thank you for having me. As you mentioned, those counties, if you look at it, are urban counties, most of them. And you look at economic activity in the country, they largely come from those counties, except the 2 other counties, which is Kisumu and Mombasa. I think the rest that are around the metropolis of Nairobi, including Nakuru, are business hubs. And so one of the main things that I think we've tried as economists to try and help in education, public education, is the conversation around there is a balance between an economy and health. And there is no such thing. It's a fallacious argument, and let me debunk it today again. The idea is that you're balancing life and livelihoods is very erroneous. Because the fact is, you find that people who mention that are people coming from privilege. When you say that you can forgo livelihood for lives. The reality is that it's a very difficult choice when we're having a pandemic, and it's a double-edged sword when the pandemic happens. You have a situation where you're shutting down the economy, and one of the things is that when you talk about an economy, it's not an amorphous thing around somewhere. These are people within an economy. And when you talk about people, these are people losing jobs. These people are losing their income. These are people losing their shelter. You cannot pay rent. These are people going to starvation because they don't have money to buy food. So you look at, for somebody who has been told that you are sacked today, you don't have a salary today, you are a breadwinner back at home, you go to your family, you cannot feed your family. And you are being told the choice is between an economy and that. Here you're already facing a life and death situation because you cannot feed your family.
Right.
And to say that you're balancing between an economy and health, for such a person, that's not the context he's fighting for. That is a person fighting for death and life, whether will he eat food today or not with his family. And you realize that before we got to this position, 1.4 million Kenyans were facing severe starvation. And so that choice is not there, that it's between an economy and lives. Within that pandemic, the economic effects of the pandemic is also a life and death issue for many people, especially for people within urban sectors where the lockdown is happening. The urban poor are the biggest people who are affected when such measures come up. And so you see there are consequences to that. You see mental issues will be coming up. You'll see suicidal people coming up. So the adverse effects is that we are not balancing anything. It's one and the same problem. So the fact that we need to have a government that addresses the pandemic, the health crisis, the public health crisis, then you can be able to address the other issues, the economic issues that come with it. It's one and the same thing. It's just in tandem. It's not that it's between these and this.
Right, and we'll be diving into that further. I understand that Dr. Andrew Were is now with us. He is the president of the Kenya Medical Association. Good morning, Daktari. And as we introduce you, I want us to take a look at some of the things that the Kenya Tourism Federation said in a statement that they released yesterday that would speak to the impact of these measures taken by the president on the economy. Do you have that? Right, and they're saying that the facilitated movement of tourist service vehicles across the country. And that allow tourists with prior bookings a free passage by air and road. This is because of the cessation of domestic flights, which was extended to today, midday. Then something else that the Kenya Tourism Federation is saying that prioritize hospitality frontline workers in vaccination exercise. This is according to the drive that is already going on. The hotel workers or tourism sector workers are not part of the priority list. Then they are asking to resume in-service dining and at establishments, of course also sale of alcoholic drinks. So it was a lengthy statement that was given by the Kenya Tourism Federation chairperson, that is Mohamed Hersi, who is saying that the measures that are taken by the president would appear not quite considerate of the situation that this hospitality industry is going through. But let me get to you, Dr. Were. Shortly we'll be introducing Wilson Susun, the Secretary General of the Kenya National Union of Teachers. But Dr. Andrew Were, you look at the measures that were taken. How do you justify them at a time that different sectors of the economy are complaining, like what you see from the Kenya Tourism Federation?
Yeah, thank you, Sam. I think what is important to note is there is no economy without having a healthy nation. And as we speak, the COVID pandemic, the third wave, was threatening to overrun the health system that you have in this country that was already fragile from the beginning. So hard decisions had to be taken to protect life first, so that we can be able to go around and do our normal economic activities. Yes, the issue of the impact it will have on the hospitality sector is something that we need to look at more critically, and the urban poor, where we need to have the government come up with packages that can be able, economic packages that can be able to actually support these particular industries. But on the question of whether we needed to go on lockdown now or not, I think that is not debatable, because the situation in most of our health institutions are dire, and we can't function without a health system in place.
All right, of course, they're making a case for the lockdown, but of course, this is coming at a time, Tony, that yes, you'll hear or you read that people are saying that when the first lockdown came into effect back in March 2020, there were different economic measures that were announced, there were different concessions that were given by the financial institutions. All those things are not there now, and we don't even know how much of an impact those announcements by President Kenyatta had on the economy. When you look at it now, is it safe to say, like the Daily Nation is saying, you are on your own?
Definitely, that's true. And let me pick up from where the doctor said that there is no economy without health. The reality is that in Kenya, it's very expensive to be poor because you have a government that says they will not be paying hospitalization of COVID related issues under the NHIF scheme. You're in a position where you've lost your job because of the shutdown and the lockdown of the country, of the 5 counties. You don't have an income. If any case you find yourself in hospital, whether it's COVID related or not, you don't have money to pay for your hospital bills. You don't have money to feed yourself. So what are we saying? That you have a choice between you have an economy, you have health first before an economy. And that's the reality that we need to rise to that. We might sit in positions that we are not related to what happens to many people. But the reality is very different from where we sit in an ivory tower. So the question that you say concerns the measures that were put in place. Last time, we had, people coming to the first lockdown. So probably you might have savings first. You might have something that you've been holding on for a period of time. That was trying to save yourself within that period. You might have finished that within the first wave and the whole of last year. So we come to the second place where the lockdown has happened. You have little cushions, first from government and from yourself. So you're left exposed on your own. And the reality is that government took very little economic measures in trying to cushion Kenyans. The large part was taken by private sector, not government, in terms of loan repayments, in terms of and all that. Much of the measures came from private sector, not government. I think government came with very few taxes, and they were lifted within 6 months. This time, government is not taking any losses, when government is supposed to be the person taking the biggest losses during this pandemic, not the private sector. So it's true that the Kenyans are on their own.
Right, and SG, I'll be getting to you. Of course, the Secretary General of the Kenya National Union of Teachers, Wilson Sossion, is here. He's also nominated Member of Parliament. But let's first take a look at where we are when it comes to COVID-19, the numbers that we have recorded in recent weeks and months. If we are to begin with where we are currently, we have conducted 1.4 million tests, and out of those, 130,000 have turned positive. Out of that, the recoveries are 91,754. That's about 70.4%. This rate is declining, Daktari. The fatalities are at 1.6%. That is 2,117. And active cases, therefore, are at 36,343. Take a look at something else that will tell you how COVID-19 has behaved the past 1 week until yesterday. The new infections that were reported in that week were 9,304. This is one of the highest in any week of the pandemic. That's an average of 1,329 on a daily basis. The new fatalities over the 7 days, 106. That's an average of 15 deaths every single day. If you are to look at what those numbers have been in hospital burden, the people that are on home-based care currently are 4,060. Again, the highest to be reported in the history of the pandemic. Those that are in hospital, 1,221, and of these, 121 are in ICU. Of the 121, 32 of them are under ventilatory support, meaning quite critical. Those that are on supplemental oxygen are 82 out of that. Then something else, the monthly infections. This is where you get to realize what an impact the month of March is going to have on the pandemic history. That in 2020, before November, the highest number of infections was 14,000 in July. Then in November, the highest month on record is 28,426. That month of March, that bar should be way higher because it's at 24,000. So Tony, don't criticize this from your economics. 24,241, it's second to November. So with 3 days remaining, we don't know whether those numbers will match November or they'll just be slightly lower than that. Something else to look at is if you are to consider the monthly fatalities, there has been 2 months that had reported higher deaths than any other. That is the month of November 2020, which had 473, and the month of October that reported 285. Already the month of March, again, that by is not proportionate. The month of March has reported 261 deaths. So it could rank number 3 as yet, but there are indications that it may be second after the end of the month. Then the positivity rate has been dancing over the months. The highest again was in November at 14.6%, and now currently the average is 13.6%. But as of yesterday, the infections that the results that we got were at 16.5% from all the tests that were conducted. And Secretary General Wilson Sossion, and also Member of Parliament, good morning and thank you for joining us in this conversation. We are talking about the state of COVID-19 and the measures that were announced by President Uhuru Kenyatta. And there has been complaints about how much of an impact this lockdown is going to have, whether you're talking about economics or you're talking about education and so many other matters. Can you justify the measures being taken, the lockdown, despite 1 year into a pandemic that we had hoped we had learned sufficient lessons on what to do when the numbers spike?
Yeah, I think, number one, there can never be 100% consensus on what the government has pronounced, but the responsibility of ensuring the safety of the citizens is vested in the government. And from where we sit, the pronouncement by the president has been informed by the medical science. And these are not personal pronouncements of the president. It is an advisory, considering the trend and the behavior of the disease. This is a third wave, and the third wave looks more lethal. There are more deaths. We are registering significantly high deaths, and a projection that if restriction measures are not put in place, we are likely to register a catastrophe in the country. So these are merely preventive measures, and to us, we think it's in the right direction, and coupled with the hope. We don't think this third wave, the management would be so difficult like the first and second, because there was no vaccine in the first and second. This one, there is a vaccine, and there is a program on how to roll out the vaccine. But then we cannot leave everything to the vaccine without putting in place preventive and restrictive measures to reduce the spread. So we think the measures that have been put in place are timely, and it is meant to stop further spiraling of the third wave so that it can be contained.
Right.
And we would want to believe that these early containment measures, of course, the arguments of balancing between the economy and other activities, aspects of life, but there can be no economy without lives. And let us be alive to previous catastrophes. This is not the first global pandemic. The Spanish flu swept away 50 million lives globally, and this one is also indeed threatening lives, and therefore there is need to prevent lives. Right. As the first instant and first responsibility of any government, because once you prevent life, you can then have an economy, you can have life, you can have human activities going on, particularly on education. You've seen the in-person learning have been suspended. Right. And the word is suspended, and only save for examination classes. We hope this time round the containment measures will be able to manage the spread of the disease, and institutions of learning should not remain closed for a long period. We suffered a lot in the previous containment measures with the prolonged closure. We hope schools and other learning institutions should be able to resume earlier enough, and probably by considering vaccinating all frontline personnel in learning institutions. Right. That is teachers, lecturers, and workers, and probably considering extending vaccination to students. So I think the highest responsibility of government, as we have seen, Joe Biden is focusing to roll out over 200 million vaccines in the U.S. and the biggest focus is rolling out the vaccines for every citizen.
Okay.
We believe this economy and the government will be able to get to that level where majority of the population will be vaccinated and priority given to learning institutions, workers, and students, so that learning can be normalized. We've had a lot of challenges arising from the prolonged closure, and those challenges may not go away very soon. We may continue
SG, we'll talk about that in greater detail. But first, let's listen to what President Kenyatta explained on why Nairobi and other counties are the target in this second lockdown.
In terms of geographical impact, Nairobi County accounts for close to 60% of the recorded cases. What this means is out of every 10 positive cases countrywide, 6 are from Nairobi. In other words, if we took a random sample of 5 people in Nairobi and tested them for COVID, 3 are likely to be positive. This unfortunate turn of events calls for urgent and indeed drastic measures.
Right, and joining us again this morning is Dr. James Nyikal. He is the Member of Parliament for Seme constituency. He's also a member of the Health Committee. And Daktari, we spoke to you last week and you are very categorical that what will save Kenya and Kenyans is the change of behavior. But now it would appear that we have to do that by force or by pronouncements from government. Do you think the measures announced are sufficient to make sure that we're able to change and contain this disease? As the president says that there appears the peak will be in about 2 months?
Yeah, good morning. The measures announced by the president are actually adequate, but measures are not enough. What is more important is how we ourselves...
Doctor, we can see you. Maybe you could activate your video.
Can you see me now?
Yes, we can. Go ahead.
Yeah, the measures are adequate, but what is more important is how we ourselves behave, and 2, how the measures are implemented and enforced. Last time, when the president actually relaxed, the mistake we made was we didn't go by the guidelines that he put down. We actually went all the way and dropped everything and went back to normal. So the third wave now has caught up with us. You know, the problem of increased transmission, that is when mutation occurs and variants start appearing. So that's also a bigger danger that our scientists will let us know. But the containment measures are what we need to do. I had only one question about them. The fact that we've closed some areas is an indication, as the president also said, that the transmission is higher in certain places, particularly Nairobi. I do not know the data which they have, particularly of deaths, because where we are now, particularly in the rural areas, some people could be dying and we do not know they are dying from COVID or COVID complications. So I would have liked to get more data on what is happening deeply in the rural areas, not in towns only even. So if the data we have is indicating that there is little or very little transmission in the counties, yes, then I think stopping movement is justified. But if it is just because we do not have the data and there is as much transmission in the counties and rural areas as are in the towns that are be declared closed, then that may not be justified. But I think sometimes it is better to err in favor of safety. If you don't have data, then you overdo so that you are safe. But that is the information that even last time I said, what is happening in the rural areas? Where is the testing? If we say that 60% are from Nairobi, what we also need to know, what is the percentage of the people that were tested? Right. If the people who are tested were more in Nairobi, then obviously it will be Nairobi. But I think the containment measures are necessary and the enforcement is necessary, and the security forces must really enforce without being brutal. Last time, what stained our efforts, although we got good results, is the brutality with which the security forces work. But later on, it worked out better. This time, so far, I've not seen complaints. So I think we are doing well. We must have the containment. The only other thing, the difference that I noticed is that last time when we did close down, we actually put in measures that were to support businesses that would be affected. This time we haven't done that, and if the closure continues for a long time, that is an area we have to look at. I believe right now the government is looking into what can we do in terms of tax measures, in terms of business support. But I also realize that we're actually in a fairly grave economic situation. But that's something we need to do, because if we don't do that, then the impact on the economy will be greater. But human life is first.
Right. And Dr. Andrew Were, Dr. there raises an important question about the proportion of testing that is going on outside these 5 counties. And actually, if you look at the numbers, majority of testing is, in as much as majority of cases are being reported in Nairobi, that's where majority of testing is being reported. So what is our national COVID-19 testing strategy like? Because when it started, it was about contact tracing. At some point, it was mass testing. What are we doing currently, and how are we prioritizing the resource distribution to different counties?
Well, that is the information that I don't have, that I would have liked to have.
Sorry, Dr. Nyikal, I meant that question for Dr. Andrew Were. He's also on the line. Dr.
I'll listen to him. Let me listen to him.
Because that is a correct picture. Our testing capability is only focused mainly in Nairobi, and that's why you're seeing enough positive cases coming from here. But if you go to the rural areas, for you to do a test as close as, let's say, we go to Kiambu in Thika, it takes you 7 days to get those results back. So our testing strategy was not properly implemented in all counties. You find, like in the western counties, they're relying on Kemri that is in Kisumu, and all those counties, it takes a long time for you to test and get the results back. Again, if you look at Nairobi, most of the people who are testing are the ones who want to travel, and those who have access to healthcare who are developing symptoms. So you see, these, Shimura has noted, you'd find that it gives a false indication that actually the number of cases are many in the urban centers, especially Nairobi, while the reports that we are getting as far as Mombasa, we're finding a lot of the ICU beds there are full. People are actually sick there. So I think for us, the containment measures in place are good. What we'll have called for is actually a complete lockdown with proper support services by the government, so that we can be able to arrest this. If we go into a complete lockdown for 2 weeks and come out of it, I think would be better. But it also calls for each and every citizen to be responsible. The issue of the vaccines are good, but it's not the solution for this pandemic. We need to continue wearing masks, social distancing, hand hygiene issues first, and then get as many people vaccinated as quickly as possible.
But Dr. Were, I hear you suggesting that it would have been better for a total lockdown for a whole 2 weeks. But what more must you do apart from lockdown? Because you might just lock down and delay the infection, then get back to normal business. What are those things that you have to do to ensure that, yes, you delay the infection, but also stop it?
Look at other countries, what they've been able to do and to arrest the infection. They actually went on complete lockdown for a short period of between 2 and 3 weeks. And when they came out of it, then they had manageable numbers, which they could be able to actually trace and even trace the contacts and be able to manage that. And that helped them to quickly open the economy. What does not make sense to us scientifically is, yes, the curfew is good because of it stops the interaction of people at night. It stops the transmission. But during the day, you see all over the country, people are not adhering to wearing the masks. People are not washing hands. It's back business as usual. So we say during the day, the infections transmission is continuing. Then we go back to our homes at night. So for us, I think we need to have even more stringent measures, but we need leadership all the way from the top. Because look at this third wave. It didn't start from nowhere. We had a series of rallies in this country, just like the second wave. And I remember us talking about this. And these are the things that have led to the spike of infections. Look at our neighbors in the south. We need to make a conscious decision to actually arrest the infections that are coming from the southern border of this country. Because the variants that we have circulating here and the results that are released clearly indicates that the variants that are there, you can actually trace from where they came from. So I think we need to be actually show leadership from the top. And each and every citizen of this country need to participate so that we can be able to arrest these infections once and for all.
And Honorable Sossion, there are many concerns. Like you hear him talking about the border with the south, and there's even already a threat from the UK embassy, or rather UK government, that they might interfere with Kenya's ranking because of our open border with Tanzania. Is there something we're missing in management of this pandemic that needs fixing?
In terms of global standards, I think as a country, we've done pretty well in enforcing measures and containing the vaccine. I don't think Kenya is very much out of the range of countries that have done fairly well in managing the pandemic world over, looking at the statistics, looking at the figures, and of course doing the regional comparisons. Of course, we compare with our neighbors in the south. We are doing extremely pretty well, except that what might be drawing us backwards is the efforts that our neighbors are also putting. We could be suffering from infiltration of poor containment measures by our neighboring countries. As we have seen, what is happening within Nairobi, we easily get very good data within Nairobi, but we don't have effective means of collecting data from the rest of the country and considering even at the borderlines. Yeah, much of the disease could also be spilling over through the porous borders and movement of populations that really cannot be contained. And this is out of the control of government unless government puts in place very stringent border measures to ensure that movement of population from other countries is contained. But this is very difficult because in as much as we define national borders, we may not define movement of people and movement of diseases. And therefore, this requires the context of COVID-19 should move from the national level to sub-regional level. Maybe at the east, then we should now be asking ourselves, what is the policy position of the East African community in terms of containing COVID collectively as family of nations? And that should also move to the context of the continent, because by the end of it all, it doesn't make sense for one country to put in so much effort and a neighboring country to do little when we are talking about a disease. We will still have a nearby epicenter that will still affect us in the long run. So speaking beyond the country, we really need intergovernmental cooperation and unified approach to the containment of the disease. Otherwise, it will not make sense for Kenya to put so much effort while the neighboring countries are doing little. With time still, the disease will find its way back, and it will draw us backwards. But I think as a country, from where we are, those of us who can see what is happening globally and who can do global comparators, Kenya has done pretty well as government in terms of implementing adequate and effective containment measures of COVID-19. Up to bringing in the vaccine, I think bringing in the vaccine in terms of the numbers that has been done and the program that is in place is a step in the right direction.
All right, and I'm looking at the numbers which we'll be talking about after the break, because if you look at the people, for instance, there's on the 25th of March, the report that came is that the infections at the points of entry, there were 2 truck drivers through the Kwale border, and then there were 2 truck drivers through the Tanzania border, I believe, in Namanga. So does that make a case for what Dr. Andrew Were is talking about? We'll be talking about that later on. But first, let's take that breather. You can text us your views on 22422 or tweet us at Citizen TV Kenya, at Sam Gituku. The hashtag to use is Daybreak. We are with Dr. Andrew Were, Dr. James Nyikao, Tony Watima, and Wilson Sosion. We're back after the break.